Hello, my name is Lindsay Adler with Norton Healthcare. Multiple sclerosis can affect patients differently, but it is important to know how to manage symptoms so you can live life to the fullest. One of the most common symptoms of multiple sclerosis can be a bit uncomfortable to talk about: bowel and bladder issues. Did you know that 95% of people whom have had a diagnosis of multiple sclerosis for 10 years or more report urinary complaints? One way to manage these issues is through physical therapy. Many people are unaware that physical therapy can help improve bowel and bladder issues such as urinary leakage, constipation, urinary retention, and pelvic pain in men and women. Pelvic health physical therapy has been around for over 40 years, and subspecialized certifications and care have developed to support patients. If you have multiple sclerosis, you may have heard of a few diagnoses as symptoms of MS that impact bowel and bladder control. NDO, or neurogenic detrusor overactivity, which is involuntary bladder contractions, may be painful, may cause leakage, urgency, or frequency issues. Detrusor sphincter dyssynergia, or DSD. As the bladder fills, the detrusor or the bladder muscle contracts to empty the bladder. The sphincter should relax, but if DSD is present, the sphincter will also contract inappropriately, causing delayed empty of urine, a trickle of urine, a sprayed stream, or feelings of incomplete empty or urinary retention. Hypoactive bladder, detrusor or bladder muscle does not work and is flaccid or weak. That means that the bladder does not empty effectively. If this is present, vibration over the bladder during urination may be helpful to help stimulate a fully empty bladder. You can pair that with a diaphragmatic breath or a belly breath. It is important to know that patients with MS are 7.6 times more likely to report overactive bladder symptoms. And 65% of patients with multiple sclerosis reported at least moderate to severe urinary symptoms, with urinary urgency being the most prevalent reported symptom. You are not alone. Treatments for these diagnoses are determined by specific presentation and underlying or concomitant conditions. Something you can try is timed voiding. Every 2 to 3 hours is a normal bladder empty schedule, or 5 to 8 times a day. If you're having trouble fully emptying your bladder, you can try a contract relax technique. That's where you do a Kegel squeeze, you contract your pelvic floor and then relax and take 3 big belly breaths to empty the bladder. You can track your urinary frequency with a bladder diary or by keeping a simple log in your phone. Normal nocturia, or waking at night to urinate, is 0 to 1 times a night. Another thing you can try is to reduce bladder irritants in your diet. There are 5 big bowel and bladder irritants listed in literature currently. The 5 are carbonation, or bubbles in your drinks, caffeine, or artificial sweetener, flavoring, or coloring. Truvia and stevia are still okay. Reducing these irritants may help in reducing urinary urgency and frequency. Physical therapy is a great tool to help patients with MS control their bowel and bladder urges, and there are plenty of exercises you can perform safely at home. An important exercise is to engage our pelvic floor. The pelvic floor is a stabilizer, which means it does not move a joint and it can be difficult to detect. When you isolate your pelvic floor, no movement should be seen from the outside. One way to engage your pelvic floor is by squeezing as if you're attempting to stop a stream of urine. Using a visual aid can help this. If you imagine holding a blueberry in your vaginal canal for women, or doing a squeeze as if you're sitting on a cold toilet seat for men can be effective in isolating these muscles. Your pelvic floor is comprised of 2 types of muscle fibers. 30% of the pelvic floor are fast twitch muscles, which work quickly, such as during a cough or a sneeze, and 70% are slow twitch or endurance fibers, which hold for longer periods, like when you're trying to hold in urine during a car ride and the exit is 10 miles away. Both types of muscle fibers should be trained to achieve optimal results. A daily exercise you can use to strengthen the pelvic floor is to squeeze at a consistent, fast pace, on, off, for 10 repetitions, 3 to 5 sets a day, or every other day. Then perform 10-second holds for 10 repetitions, again for 3 to 5 sets a day, or every other day. Relaxing your pelvic floor is just as important as squeezing and strengthening, so make sure you take time to fully relax the pelvic floor during the off phase. To assist in this, you can take a large belly breath by breathing in and allowing your abdomen to round out. Mastering the Kegel squeezes lying down can help in detecting the pelvic floor movement and isolating the appropriate muscles. You can then move to seated and standing positions once you have mastered it lying down. Additionally, it can be important to address any known scarring in the abdomen to help with pelvic floor symptoms. Scar massage, 10 minutes a day to your tolerance, can help loosen the tissues around the scar and help reduce irritation in the bladder. Make sure to use a neutral lotion and rub along the scar for 10 minutes a day. One additional way to engage and strengthen our pelvic floor is by strengthening the hips. Standing hip extension at a sink, standing hip abduction or kicking your leg out to the side at a sink, or clamshells lying down can all help strengthen the outside muscles of our hips. Generally safe exercises to try at home are anything to promote hip and spinal mobility and stability. You can do a seated piriformis stretch for 30 seconds to 1 minute, a seated hip flexor stretch for 30 seconds to 1 minute, a seated cat-cow exercise for 10 repetitions, and diaphragmatic breathing or belly breathing, followed by the functional squeezes or the Kegel squeezes. Ultimately, it is important to consult your healthcare provider about your medical diagnoses and symptoms. If symptoms worsen, you may require a pelvic floor physical therapy evaluation. If pain or urinary retention or leakage worsen, stop and contact your provider. Other treatments found in the clinic are biofeedback, which is a computer system that uses electrodes to monitor electrical activity in the muscles, or electrical stimulation or neuromodulation techniques can be performed in clinic. As part of the comprehensive care provided at the Norton Neuroscience Institute, you will receive a full assessment with tailored treatment, including support for your bowel or bladder issues. Thank you for joining us. To learn more, go to nortonneuroscienceinstitute.com.